CNA Prep Guide. Welcome to the quiz. Question 1. Postmortem care requires specific techniques performed with dignity and respect for the deceased. Following the pronouncement of death for a long-term hospice patient, you prepare to provide postmortem care. Which action is included in standard postmortem care procedures performed by nursing assistants? Option A. Remove all medical tubes, lines, and catheters to prepare the body for viewing. Option B. Position the body in a prone position, face down, to prevent pooling of fluids. Option C. Gently close the eyelids if they remain open after death. Option D. Apply fresh makeup to restore a natural appearance for family viewing. The answer is C. Closing the eyes gently if they remain open is standard postmortem care. This provides a more peaceful appearance and respects cultural norms. Tubes and lines are typically left in place until specific instructions are given. Question 2. Maintaining professional boundaries while providing compassionate care requires appropriate responses to patient behaviors. While providing evening care to Mr. Thompson, a 68-year-old patient recovering from orthopedic surgery, he makes inappropriate sexual comments about your appearance and makes suggestive gestures. What represents the most professionally appropriate initial response to this situation? Option A. Laugh nervously to diffuse tension while quickly changing the subject. Option B. Firmly but calmly state that such comments are inappropriate and unprofessional. Option C. Ignore the comments completely and continue with care tasks without reaction. Option D. Immediately leave the room to report the incident to the charge nurse. The answer is B. Setting clear. Question 3. Adapting care approaches for patients with sensory impairments enhances safety and communication. When preparing to enter the room of Mrs. Lewis, a 92-year-old resident with severe macular degeneration and significant visual impairment, which approach represents best practice for entering her room and initiating interaction? Option A. Knock once and immediately begin speaking to alert her to your presence. Option B. Enter as quietly as possible to avoid startling her with sudden noise. Option C. Announce yourself clearly, identify objects you're moving, and describe your actions. Option D. Turn on all available lights to maximize illumination before approaching her. The answer is C. With visually impaired patients. Question 4. Performing range of motion exercises correctly helps maintain joint mobility and prevent contractures in patients with limited movement. During a training session on proper ROM techniques, the physical therapist emphasizes important principles for effective exercises. Which statement accurately describes correct practice for performing range of motion exercises with patients? Option A. Perform exercises quickly and efficiently to minimize patient discomfort and save time. Option B. Complete a full set of exercises for each major joint at least 3 times daily. Option C. Continue each motion until the patient complains of pain, then proceed slightly further. Option D. Reserve all range of motion exercises for physical therapy staff with specialized training. The answer is B. ROM exercises should be performed at least 3 times daily to maintain joint mobility and prevent stiffness and contractures. Quick exercises risk injury and don't provide adequate stretching. Exercises should stop at the point of resistance or discomfort. Question 5. Accurate pulse assessment requires understanding appropriate timing and technique variations. As you assess Mr. Johnson's radial pulse during routine vital signs, you consider the optimal timing method for obtaining an accurate resting pulse rate in a stable adult patient. When measuring radial pulse during routine assessment of a stable adult patient, for what duration should you typically count the pulse beats to ensure accuracy while considering clinical efficiency? Option A. Count for exactly 15 seconds and multiply by 4 to calculate beats per minute. Option B. Count for 30 seconds and multiply by 2 to determine the minute rate. Option C. Count for a full 60 seconds to obtain the most accurate measurement. Option D. Either counting for 30 seconds multiplied by 2 or 60 seconds is acceptable. The answer is D. Both 30-second and 60-second counting are acceptable for routine pulse assessment. 60 seconds provides greatest accuracy. Question 6. Proper technique when emptying urinary drainage bags prevents contamination and infection transmission. While emptying the catheter drainage bag for Mrs. Rodriguez, who has had an indwelling catheter for 5 days postoperatively, you must avoid specific actions that could introduce pathogens into the system. Which action should you carefully avoid during the drainage bag emptying procedure? Option A. Wearing clean gloves to protect yourself from potential exposure to urine. Option B. Allowing the drainage spout to touch the inside or rim of the collection container. Option C. Measuring the total output volume in a graduated collection container. Option D. Accurately recording the output amount in the patient's intake/output record. The answer is B. The drainage spout must never touch the collection container to prevent contamination. Contact introduces bacteria into the drainage system. Great job! Don't forget to subscribe. Bye.